Keep walking, we fall down. Good, keep holding, keep falling down. You are peace, peace. I'm all I need for you. For you, I will be. You are peace, peace. I'm all I need for you. Peace. Anything for you, I will be. That's all I need.
9:45 at break and then 9:30. Send me the link.
Pray for guidance and hope when he opens my heart. Love when the faith filling up, but I know I fall. It's a Lord. Yeah, but I've been trying to get it right. So I'm steady praying in the night. And I'm staying focused on the prize. All I'm thinking about is paradise. It's only Jenna, I got my eyes on. Peace is the only thing I want. And so I call out, oh Allah, Allahumma anta it's only China, got my eyes on. Cause peace is the only thing I want. And so I call out, oh Allah, you are peace, my Lord. I need you, anything for you.
Assalamu alaikum wa rahmatullahi wa barakatuh, and welcome to the PMB Pulse Show. I'm your medical presenter, Shubnum Ismail, and we are live at the Al Ansar station at 240 Ottoman Road, jamming out on 90.4 Durban and 105.6 FM Pietermaritzburg. Every day, countless individuals endure the trauma of abuse, physical, emotional, and sexual or economic, often in silence. Gender-based violence doesn't just wound the body. It fractures minds, fuels chronic illnesses, and ripples through families and communities for generations. Yet, with the right knowledge, resources, and compassion, we can rewrite these stories. So, listeners, please welcome a pillar of our Pietermaritzburg Central community on today's show, The Pulse Show, Dr. E.N. Soni. Good morning, Dr. Soni, and it's so great to have you with us.
Good morning, Shubnum, and thank you for the invitation.
Dr. Soni, our show today is going to unpack several aspects, but you have been an incredible doctor for the past 35 years and a trusted family physician who never stops giving. Your practice spans the full spectrum of care, from everyday family medicine to specialized services that keep our community thriving. Beyond the clinic walls, Dr. Soni plays a vital role at our Northdale Hospital's Crisis Center, where he assesses victims of gender-based violence and carries forward the legacy of the former district surgeons, a testament to his deep commitment to both community health and forensic medicine. Add to that his dedicated travel clinic, where he crafts personalized pre-travel consultations, vaccines, and health advice also for the Globetrotters, ensuring every journey begins safely. A true blend of seasonal clinical expertise and heartfelt compassion, Dr. E.N. Soni stands as a dedicated healthcare professional devoted to the holistic well-being of his patients, whether it's at his practice, the hospital, or on the road. Today, we're diving into three very crucial conversations, that is, gender based violence, chronic conditions, and the essential role of travel medicine. So, listeners, let's settle in, open our hearts, and let's start this crucial conversation because no one should ever have to suffer in silence. Stay with us. So, Dr. Soni, I know that you juggle many roles between the public and the private sector. What is the best part of your job?
I think I need to start off by saying I'm privileged. I need to say thank you. I'm able to take care of people, assist them with their health and with whatever problems, and really to bring joy to someone, to assist them with their health, and to ensure that when they walk out, you have done something for them. And not all of us have that privilege. So I'd say thank you.
Alhamdulillah. And listeners, doctors touching lives every day, which is such a blessing. And doctor, what sparked your passion to become a district surgeon specializing in sexual abuse?
It's one where most of us shy away from. It's unventured. And at the time, I thought, I have so much to give, so much for people that are vulnerable, indigent, and who've been through trauma. And I have never looked back.
So I'm sure our listeners would like to know about that background and a little bit deeper about your examinations. Can you walk us through what is the process after an assault and what does a rape kit contain? And I see you brought one with you.
Yes, I can lift the rape kit up for those that are able to see. Your rape survivor that presents to you, you must remember that difficult process. They've been through trauma and now they're coming to your offices. You need to make sure they're in a safe space. They've been through their counseling with the social worker and they've recounted what has occurred to them. Then they would come through to the doctor and they need to have written consent on a form called SAP 308, which is signed both by themselves and by the SAP member that may have brought them or would subsequently come in if the case has not already been opened. But at all times, you avoid secondary trauma. Non-judgmental, objective, making your patient comfortable. You need to take a full history of what occurred. Where did it occur? What occurred? Who did what? How did they do it? And through all that process, you need to give them time. Because remember, GBV knows no bounds. It can occur to anybody, from any religion, from any race, and any age.
Yeah. And we spoke earlier that it's not only females. You see males at the hospital as well. And what does the kit actually contain? And I'm assuming that it does actually present itself at court if you have to actually take some sort of samples, etc.
Correct. It's called D1, Adult Sexual Assault Evidence Collection Kit for Biological Evidence. And those of you that can see it, it's actually a sealed kit. So I can't once I open this kit can no longer be used again. And it's actually first world. It's barcoded and everything within is barcoded. So you have a link. Remember, we're following a medical legal process. And the legal process is such that there must be no doubt. If there's any doubt, that assists in the case being problematic then. So your kit contains 6 pouches. Peel pouch 1, which has a mask, so you have a mask available for use. Medium and large gloves in peel pouch 2. Peel pouch 3, it's got a brown paper bag. Tamper evidence seal, so sealed so that nobody can tamper with it. A smaller bag, waxed paper, and another seal. Then you have peel pouch 4, which has evidence collection box. So if you maybe need to take a tampon and a seal for that.
Okay.
Then peel pouch 5 and 6 have round tip swabs, that you will be using swabs to obtain specimens. Remember, at the end of the day, we want to try and link. So we want to take DNA. So we have swabs, and it has within a little water vial. So again, you can't contaminate. So it's sterile water that you drop and just moisten the swab. It's like a long earbud and a seal so that you can seal it. Then you have an evidence sealing bag so that you can reseal it once you're done. An instruction leaflet for someone who hasn't done it before or needs some information. And then the J88 form. That is your justice form. That's why J88. And that's where you'd record all your findings to indicate what the survivor told you, what happened, what your examination shows, and that you used a kit.
You know, listeners, we must make dua for our kids, our families, and our friends that they don't end up seeing a district surgeon and have a procedure of this kind, because I'm sure it's emotionally taxing on you as well, doctor. And in terms of the legal responsibilities of your profession, you obviously document evidence for the case, and you have to be quite accurate. Do you see also quite a lot of teenage pregnancy coming through your doors?
Absolutely. Teenage pregnancy is an absolute crisis currently. If I can appeal to the listeners, please, at the end of the day, look out at your teenagers, look out at your young girls. I see young girls from the age of 12, pretty young children having a child. Not correct.
Yes.
We need to be more aware, ensure that if both parents are working, when that child is returning from school, they're returning to someone and they're not left to their own actions for a couple of hours, such that you don't know what they're doing.
Yes. And yesterday, the world was actually lit in purple from statuses and campaigns. It was really an emotional but such a lovely day to actually create awareness for GVB. So, doctor, on that note, what changes would you prioritize if you could redesign the gender-based violence response system tomorrow?
We are currently a crisis center, and Harry Gwala, which is the old Etondale, is the Tutuzela. So it would be ideal where we have more Tutuzela care centers, where it's a one-stop shop. The survivor comes in, the SAP is there, the NPA is there, the social worker, the psychologist, everybody can provide support to you in one venue. So it would be basically where we can improve and we can have more improved care to your survivor.
And it's also about education. We spoke about this earlier before we kicked us out with the show, that we all can be ambassadors to speak to the learners, adopt the project at schools, and just make it not only a seasonal campaign, but 365 days and beyond, doctor.
I absolutely agree. The 16 days is not sufficient. It should be every day. And every opportunity, I feel, we need to plant that seed.
Yeah.
We as parents, I'm a parent of 2 children who are grown, but we need to make them aware that you need to be safe wherever you go. If there's anything happening, you need to be able to reach out. Don't just live in a silo and think, no, everything is fine.
And can you share a memorable case where the patient's resilience inspired you?
I have 2 survivors. Remember, it's very personal, confidential information. So at the end of the day, all I can say, 2 of my survivors have gone ahead and grown from that trauma that they developed. And they formed their own organization and they're giving back to survivors.
Wow,
They're
alhamdulillah.
doing something to ensure that people that have gone through trauma are assisted.
Oh, that's such a beautiful story. And what's the one thing you wish the public understood about the aftermath of sexual abuse?
It's extremely difficult. You know, the trauma and the pain no one can experience, and I would pray that no one should experience it. I often ask the survivors, why didn't you come earlier? I see survivors coming 1 week later, 3 weeks later, 3 years later, multiple years later. It's that pain, that trauma, that embarrassment. There's also a blame. Was I responsible? Did I allow it? Did I put myself through that? So it's difficult thing for someone who's been through trauma and to come forward and to actually go through this examination, be examined, and go through the SAP and then the courts.
Yes. In terms of being updated and keeping yourself knowledgeable about forensic medicine, can you give us a little bit of update how you get your self, obviously updated in terms of other worlds and what's happening there?
Absolutely correct. You need to keep updated. Unfortunately, with technology today, there is so much available to you. But from our side, we have workshops, we have trainings, and we have a group, clinical forensic medicine group, that we communicate with each other at regular intervals. And if anybody has a challenging case or they have challenges going on, then they will put it on the group and you're able to discuss, and you had different minds and different thoughts assisting you in that process.
Yes. I know that you actually split in so many roles in your field of medicine. What emotional toll does this work take on you, and how do you practice self-care?
The emotional toll, I find sometimes I'm a bit paranoid when I think about things, or if you think about the young and whatever, and I'll say to someone, no, you can't do that. I was saying to you earlier, I wouldn't encourage stayovers for my children, because I think that at the end of the day, even if you're going to family or friends, we don't know. They need to be greatly supervised. But for myself, my spiritual and my prayer is very important to me. Meditation, gym, yoga, and running.
So that you can revitalize, reconnect, and be there for your patients.
Absolutely.
Okay. And can you recall a moment when you felt you truly made a difference for a survivor?
We had a survivor who was raped, and we did the examination. And a year later, the day before the court date, the perpetrator was around in her area and going around and saying things about her. And the next day, he did not pitch at court. The patient actually had a psychotic episode. But in that psychosis, she realized her safe environment was our crisis center, and she came back to us. We had to close off the crisis center because she was so psychotic, sedate her and transfer her to the wards to be admitted for 3 days. And she can recall nothing what happened in that psychotic episode. But she reached out to us because she remembered us as the safe environment. So it says a lot for you that even in that state, she was able to think of us.
So we're ahead of actual 16 days of activism that's going to be coming up. What would be your message to our listeners out there, the community, and of course, the educators at schools?
First of all, I'd say 16 days is definitely not sufficient. As you said earlier, 365 days. So it's a continuous, ongoing process. Let's not just do it for these 16 days, but ongoing, pass this message on. Make sure that you are always safe. Make sure you do not do substances. Wherever you go, I find people, why are you walking at midnight at 2 o'clock in the morning alone? You have a fight with your partner and then you leave your premises. Okay, you've had a negative experience, but you need to keep safe. So the 16 days of activism is obviously the time when we can spread the word more, but we need to continue for the 365 days thereafter.
And are there enough safe houses in Pietermaritzburg? Like if somebody does face a crisis in the middle of the night, who do they contact and how do they get to a place of safety?
They obviously need to contact a social worker, which could become difficult after hours, but obviously going to your casualties, to your emergency centers. We unfortunately don't have enough safe houses, and there are times when they are full so that you don't have, but at the end of the day, we don't give up.
I'd like to thank the Mountain Rice division for, that oversees GVB. I know that Sham Gafford and his team really stretch out, and I've had a few clients that I had to actually reach out and assist. And, he sent his team across. So they are doing some great work in the city. And I know that they've adopted some awareness programs that's coming up. So hopefully we can actually share our knowledge and our experiences and help our community. Alhamdulillah. Alhamdulillah, and inshallah that we can continue to do great work. We're going to take a short break, and please, listeners, don't go anywhere. We'll be right back with more insightful advice on chronic care that's going to be coming up. So stay tuned, and we'll be back in a flash.
Radio Al-Ansar.
Durban, get ready for something fresh. Wednesday, 26 November, the Culinarium opens its brand new store at Musgrove Centre. Step into a world of premium kitchenware, home essentials, appliances, gadgets, and so much more, all crafted to elevate your cooking experience. And to celebrate the grand opening, we're dropping exclusive opening specials you won't want to miss. Whether you're a home chef, foodie, baker, or love stylish living, the Culinarium Musgrove has something waiting for you. Join us Wednesday, 26 November for the official grand opening. The Culinarium, where great kitchens begin.
This and only this is Nightline. Nightline is the only program that allows you to listen to the opportunity to voice your opinion on any matter or any topic that concerns you. Also on Nightline, we interview the famous, the not so famous, and infamous. Assalamu alaikum wa rahmatullahi wa barakatuh. My name is Brother Muhammad Variawa, and with me in the studio is Dr. Anwar Jiwa. Join us every Saturday night from 8:30 p.m. to 10:30 p.m. on Nightline, the program designed especially for you, the listener.
ادعو إلى سبيل ربك بالحكمة والموعظة الحسنة وجادلهم بالتي هي أحسن. Invite all to the way of your Lord with wisdom and beautiful preaching, and reason with them in a way that is best and most gracious. Join Shabir Pasha every Saturday at 7 p.m. on the show Dawah Dynamics, and every Sunday on the Dawah Chronicles at 9 p.m. remembering the companions of Prophet Muhammad, peace be upon him. Join the discussion, analyze the life, sacrifices, and contributions of the Prophet's companions, and learn from their experience.
Radio Al-Ansar, 24/7, 365.
Doctors and guests on a medical files program will help you with any medical problems you have by giving you advice on air. However, they do not have your full medical history and they have not seen you. Please verify the advice given to you on air with your doctor who knows you better. Neither the doctors nor Radio Al-Ansar will be held responsible for any ill health caused by the advice given on Radio Al-Ansar.
You are listening to a live broadcast from Radio Al-Ansar, Pietermaritzburg, 105.6 FM.
The morning when I wake, you're the mistake. When you're by my side, I take this lonely world and strive. Every time you're next to me, I get that sweet serenity, the heavenly sweet love, heavenly sweet love, coming from way up above. It's a love, 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 sweet love. One day I have to say goodbye when I cross over to the other side. But here you wait for me until we can spend eternity. Every time you're next to me, I get that sweet serenity, the heavenly sweet love.
Assalamu alaikum wa rahmatullahi wa barakatuh, and welcome to the PMB Pulse Show on this beautiful Saturday, alhamdulillah. If you're traveling and you've just tuned in, I'm your medical presenter, Shubnum Ismail, and we are live at the Al-Ansar station at 240 Ottoman Road, jamming out on 90.4 Durban and 105.6 FM Pietermaritzburg. This Saturday morning, we're diving into three crucial, often intersecting worlds: gender-based violence, chronic conditions, and the essential role of travel medicine. Our next segment is about chronic care. Now let's talk about the long-term health ripple effects that often follow gender-based violence, chronic conditions, Think hypertension, diabetes, autoimmune disorders, and persistent mental health challenges don't appear out of nowhere. So, research shows that prolonged stress and trauma can literally rewire our bodies, turning a painful experience into a lifelong health battle. That's why chronic care isn't just about managing symptoms, it's about holistic, patient centered support that addresses the physical, emotional, and social dimensions of health. Early screening, integrated mental health services, and coordinated care teams are essential to break the cycle and improve quality of life. Our guest, Dr. Ian Soni, is going to walk us through practical strategies to keep our patients thriving despite the odds. So listen in. It's great to have you with us, Dr. Soni, on the Saturday morning at the Al Ansar studio.
Thank you.
So tell us, what are the common chronic illnesses you manage at your practice?
Diabetes, hypertension, HIV, osteoarthritis, and depression.
And what advice you'll give our listeners who are on long-term chronic care for conditions like HIV and diabetes?
Can I ask you a question on that?
Certainly.
If you were to choose, and you're not allowed to say none of the above, which one would you choose? HIV, diabetes, or cancer?
I would say diabetes. It's easy to manage. In terms of cancer, because I deal with oncology patients, it depends what stage they are, and it's difficult because sometimes the treatment does not always work. HIV, I would say there's new research. If it's managed with medication, yes, you can have a long-term lifespan, but it needs to be latched on early. But I think because I have diabetes in my family and, I look at the chronic and the care, I think it's something that you can manage. It's a lifestyle change.
I have to disagree with you, unfortunately,
Really?
Shubnum. No, diabetes is one of the worst diseases to have.
Word. Okay.
Mild diabetes, yes, by all means. But I would say HIV. It's one of the best treated diseases in the world. You see your doctor once in 6 months. You have a tablet that you take once a day. There's talk of an injection once in 6 months.
Okay.
In state, you see your doctor, you do your bloods once in a year. Diabetes, on the other hand, everything you put in, every morsel, whether it's carb, people say, but I don't eat sugar, doctor. It's not just the sugar, it's the carbohydrates. Whether you eat or you don't eat, you exercise or you don't exercise, you drink water or you don't drink water. Diabetes is a great challenge, even in the first world countries. It's one of the worst treated diseases, in my opinion.
Thanks for that feedback, doctor. Obviously, you've expanded my knowledge on the HIV, and I can obviously share this with the students that I actually, impart information to. In terms of challenges, can you tell our listeners, in terms of chronic medication, how can they stick to the regime and how can they make it part of their lifestyle?
They need to understand, and diabetes is one of the main ones, that adherence is absolutely vital. So you need to dig deep within yourself and decide, I'm going to put a reminder on my phone. Today with technology, it's so easy. You put reminders to say, I need to take at 8 a.m., 8 p.m., or I'm having lunch at 12 noon or whatever. I need to take my medication then. So you need to make, I see some people will have reminders, and with the HIV we find, because they're taking one tablet a day, they put a reminder on their cell phone because it needs to be taken the same time each day. So you, as a patient, you need to realize you're seeing your doctor once in 6 months, once a year. This is your body. You need to take responsibility and say, I'm going to do the best I can. It's there. I can't change that it's there, but maybe I can make sure it doesn't deteriorate and get much worse very quickly.
Yes. And in terms of lifestyle, I know that you spoke about your hobbies to keep your self-care at bay. In terms of diet, exercise, sleep, obviously this helps with managing chronic disease. How would you help patients make some realistic changes with their lifestyle?
Lifestyle is most important in all chronic diseases. We need to ensure, you've mentioned the very things, diet. No sugar, water. No fizzy drinks. The fizzy drinks are trouble, please, people. It should be part of a treat, not every day. There are families that take fizzy drinks with 2 meals a day, if not 3. We need to eat enough fruit, salad, less fried stuff, less takeout. Make the food at home. You can make it part of a family thing, right? Mom prepares most of it, but when you come from work or you come from school, you're involved in it. Exercise. That word needs to be part. Previously, we used to say 5 days a week. Now it's gone to 6 days a week. At the end of the day, I know of this one group, yoga group, that he says just do 5 minutes a day, because he knows the chances are you won't do 5 minutes. So we want habits. Do it every single day. But I say, okay, I give you 6 days, you get 1 day off. And then the last one, sleep. We need to sleep for at least 6 to 7 hours every single day. Most people. Some people get away with less. But we find that with the stress today and the demands out there for people, we need to get adequate sleep.
And staying hydrated, of course. Especially when Pietermaritzburg, we have 4 seasons in one day, Doc. So you got to carry that water bottle around, hey?
Absolutely. I call it my doo-doo bottle. It needs to be with me.
You know, in terms of you being the chairman of the South African Medical Association, you obviously have affiliated yourself over decades to hundreds of doctors annually at local conferences. And most recently, Doc, you actually had your 52nd conference. So can you elaborate about the impact of sharing best practices and how significant this milestone is in continuous pursuit of clinical excellence and professional camaraderie?
It's a huge commitment, if I can say. It's months of hard work, reaching out to the doctors, reaching out to sponsors, liaising with different speakers to ensure that we can give the best possible. But I find it's stimulating, and it's good to see when you get all the doctors together and you're able to share some information and ensure that at the end of the day, what we give to our patients is going to be the best.
Yes, and we're very fortunate in KZN and Pietermaritzburg to have renowned surgeons and specialists that, you know, they are equipping other junior doctors. And at your South African Medical Conference, you're able to impart this knowledge and grow our ummah with education. Alhamdulillah. Alhamdulillah, sisters, we're going to pause for a beautiful nasheed break. Let the soothing moment remind us of peace and balance to seek in both faith and health. Inshallah, the melody will refresh your spirit before we dive back into discussion on travel medicine. So stay with us. We'll be right back.
Africa.
Do you have abayas, samiras, scarves, kitchenware, games, toys, furniture, or small appliances maybe that you're not using? Why not donate to Declutter? The Pietermaritzburg Muslim Women's Organization, together with the Al Ansar Foundation, are asking you to donate your unused but reusable items for their annual jumble sale. Drop off your item at Al Ansar offices at 207 West Road, Overport, or the Al Ansar offices in Pietermaritzburg at 240 Orkman Road. Drop-offs run until the 24th of November 2025. Let's get together and declutter for a cause. The jumble sale making a difference in Pietermaritzburg.
Get ready for Green Thumbs Up with the gardening and natural living show you didn't know you needed. I'm your host and life coach, Rabia Carvalho, and we're talking birds, bees, butterflies, and blooms, growing food and garden rooms, home-based holistic healing, and much more. Whether you're a seasoned gardener or nature lover, plant assassin, or permaculture professional, we got you. We got you. Let us bring you the ideas, the facts, support, and inspiration to go green wherever you are. Sundays 9 to 10 a.m. only on Radio Al Ansar.
Hungry for a deal that hits the spot? Get the top duo deal. 2 large margarita pizzas plus 1 topping each for $1.99. Or go big or go home with the Bellissima duo deal. 2 large Bellissima pizzas for $2.69. Pure flavor perfection. And that's not all. The snack box combos are here. Your pizza boy's favorite pack to the ultimate munch box. Don't forget our daily lunch specials. Delicious, quick, and wallet friendly. Only at Pizza Boys. Taste that hits different. Pizza Boys. Bring your far boom to your slice of life. Find your nearest Pizza Boys near you. Pizza Boys. We don't cut corners.
اللهم انصر إخواننا المستضعفين على أرض فلسطين. اللهم انصر إخواننا المستضعفين على أرض فلسطين. اللهم حرر المسجد الأقصى من اليهود الغاصبين. اللهم انصر إخواننا المرابطين على أرض فلسطين. اللهم شد أزرهم وسدد رميهم برحمتك يا أرحم الراحمين. اللهم الطف بإخواننا في كل مكان يذكر فيه اسمك يا أرحم الراحمين. استنصروك يا الله فانصرهم. اللهم ارحم الضعفاء والفقراء والمساكين والأيتام والنازحين والمشردين والأسرى يا أرحم الراحمين.
اللهم أنج المستضعفين من المسلمين في فلسطين. اللهم كن لهم عونا ونصيرا. اللهم كن لإخواننا المرابطين في المسجد الأقصى. اللهم كن لهم ولا تكن عليهم. اللهم فرج همهم، نفذ كربهم، داوي جرحاهم، عاف مبتلاهم، اشف مرضاهم، ارحم موتاهم، تقبل شهداءهم.
Audio stream across the world on radioalansar.co.za.
Doctors and guests on a Medical Files program will help you with any medical problems you have by giving you advice on air. However, they do not have your full medical history and they have not seen you. Please verify the advice given to you on air with your doctor who knows you better. Neither the doctors nor Radio Al Ansar will be held responsible for any ill health caused by the advice given on Radio Al Ansar.
You are listening to a live broadcast from Radio Al Ansar, Pietermaritzburg, 105.6 FM.
I don't wanna walk with fear no more. I will never leave my prayer. I know that you're always there. For every door that you close, you'll guide me to many more. So many ways you show me your love. I'm thankful for all that you've done. Alhamdulillah, for all that I have, for all that I lose, it still leads to you. For the nights that I'm down, you're all I need now. My face meets the ground. Alhamdulillah, for all that I have, for all that I lose, you still pull me through. For the nights that I'm down, you're all I need now. Alhamdulillah. على كل حال. So many ways you show me your love. I'm thankful for all that you've done. Alhamdulillah. It's thanks to you for the next time you're running me now. على كل حال الحمد لله for all that I have, for all that I lose, you still pull me through. For the nights that I'm down, you're all I need now. Alhamdulillah. Alhamdulillah for all that I have, for all that I lose, still leads to you. For the nights that I'm down, you're all I need now. Alhamdulillah, yeah.
Assalamu alaikum wa rahmatullahi wa barakatuh, and welcome to the PMB Pulse Show on this beautiful Saturday morning. I'm your medical presenter, Shubnum Ismail, and we are live at Al Ansar Station at 240 Ottoman Road, jamming out on 90.4 Durban and PMB 105.6 FM. It's time to get back to the health checklists you need before you pack your bags. Whether you are heading to the holy cities for Hajj or Umrah, or jetting off to explore the wonders of Turkey, Dr. Soni is here with the practical vaccine advice you can't afford to miss. So, doctor, tell us about travel vaccine and why is it essential?
At the end of the day, COVID has shown us there are so many variables there. There is so much that can happen to us, and travel has become more difficult. So we need to ensure that at the end of the day, we don't need to pick up any diseases. We cannot obviously have any injuries. So your travel vaccines, remember, is using your immune system to ensure that you have antibodies. So depending on the area you're traveling to, you look at those and then accordingly take vaccines that will assist you with illnesses that are likely to occur in that area.
Yeah. And some of us, we have scholars in school, and you get the letter coming through saying we got this HPV. Can you elaborate a little bit about vaccines besides travel vaccine?
HPV is an important vaccine to consider for your young children from the age of 9 upwards. And for your teenagers, it can be given to girls and boys, and it can help to prevent cancer. It can help to prevent warts. So it's an important consideration to add to the vaccinations that children are having, teenagers are getting.
And for somebody who's obviously going to travel for Hajj and Umrah, how far in advance should a traveler book their vaccines?
At least 2 weeks. You need to ensure that you've taken the vaccine, you've given it time to allow so that you will have antibodies. We have patients coming the day before they leave, and by the time they return, then the vaccines are starting to work. So it's better to do earlier rather than later, so that at the end of the day, you will get the full benefit from your vaccine.
And are there any side effects with travel vaccines?
Everything has side effects, unfortunately, Shubnam. You could have, but not major side effects. Obviously, we exclude that you are not ill at the time, you're not allergic to eggs, and you're not on any medication that would be a contraindication. Other than a sore arm for about 2 days, feeling a little tired, especially if you've taken 2 or more vaccines, or if you have chronic illnesses, most vaccines are very well tolerated.
And have there been any updates for travel vaccines?
Travel vaccines are updated all the time, and we get them from the South African Society of Travel Medicine, from the CDC. For example, if you look at a year ago for the Hajj and Umrah, they had included polio for a short period, but I see they removed that. And then now with the yellow fever, it's basically lifelong. So it's easier. And then the meningitis, it's a very good vaccine to have.
Yeah. And obviously, health professionals like myself, would you like to just elaborate about the hepatitis vaccine?
Hepatitis is a very important consideration. You have the vaccine called Twinrix, which is a combination of hepatitis A and B, and it's covering you for both food and water diseases and blood and anything else that you would be in contact with body secretions. So it's an important vaccine, and in the health profession, we should ensure that our hepatitis B is up to date.
And we're growing close to the holiday period. Any advice for our mums or breastfeeding mothers with regards to vaccines and safety?
With mums that are breastfeeding, it becomes a little difficult. Your live vaccine is contraindicated. So your yellow fever, for example, you would not give the meningitis. You can use your flu vaccine, your hepatitis A, which are killed vaccines. You can actually use them.
Yeah, we all have been through also COVID-19. And as a practitioner, doc, I'm sure you've taken a strain. What's your opinion about the 19 vaccine?
That's a difficult question, Shubnum. I have mixed feelings about it. I did take the vaccine. I'm a vaccinator and I believe in vaccination, but I think we have had challenges. More research needs to be done. I don't want to blame the vaccine entirely. COVID itself was a horrible, dangerous disease that really caused havoc for the world. But I would say if we can do more research and see what the long-term effects of COVID and the vaccine have been.
Yeah. In terms of our listeners, I have a question from one of our listeners that want to know a little bit about CGM. And I'm curious, what is CGM, doctor?
Continuous glucose monitoring. So currently you have your glucose monitor at home and you have to prick your finger each time you need to check your sugar, and we would check before meals, 2 hours after meals.
Yeah.
So you could check about 6 times a day. You'd be pricking your finger. Now we have a monitor that you can place on the side of your arm, and it will remain there for 2 weeks, and all you will require is a smartphone, and you can check your sugar any moment, and it gives you a reading. It's reasonably reliable, not 100%, but if it's placed correctly and used correctly, you can keep it on for 2 weeks. It's a little bit more expensive and difficult to get from the medical aids unless you're a type 1 diabetic, and depending on the scheme, but definitely something to look at.
So basically, you're going to be having your own QR code
Yes,
to monitor yourself.
absolutely.
That's really innovative. And I'm sure that will be quite easy and effective, especially for our elderly patients, our mums and our dads, etc. In terms of health checks, doctor, and I feel this is very, very important, that a patient shouldn't only come through to you when they're sick. How often should an individual visit the general practitioner for a general checkup, or what is routine bloods that could be done annually?
That's a very, very good question, Shabnam. And it is one I brought up at the men's function this week. It was International Men's Day on Wednesday. And I said, we have this knee-jerk reaction. We only go to the doctor when we are ill. We need to do it at least once in 6 months, if not once a year, where we look, do you know your numbers? Do you know what your blood pressure is, what your blood sugar is, what your weight is, right? What your cholesterol is? Men, as we're getting older, over the age of 40, 45, 50, what's your PSA? What's your prostate level? Women, when last have you done your pap smear, your mammogram, your bone density? So annual screening, where depending on what your family, what your genes are like, we look at all our different readings.
So, listeners, I hope you diarize, if not now, because I know we're all in the holiday mode, diarize early next year to try and prioritize to see your doctor and get these vital checks done. Doc, I'm a bit curious. Can you tell us a little bit about your men's day that you had, and what was the message or what you tried to achieve by acknowledging that day?
We had a luncheon for the men at a Kiso, and it was the staff, the nurses, the gardener, and the maintenance. And basically, it was to break the silence. I'm not sexist, but we men are terrible in that. We look after everybody else, but we'll keep quiet about anything that's happening within you. And it was basically bringing to their attention, go for your annual checkup, check your prostate, check your dipstick.
Yes.
If you're having problems with men's health, then maybe there's something else happening with the heart. You need to check your heart out. So if you're having an erectile problem, it's not just purely an erectile problem. It is warning you that something's happening to your heart. You need to check your heart out.
Yeah. And yesterday there was a lot of hype regarding GVB and women. And, we were in conversation earlier, Doc, about focusing on the men that also go through GVB and also initiating programs for them so we can also support them.
Again, it comes back to the question of silence. And with men, unfortunately, most of the men are perpetrators, but there are men that are survivors, and they get embarrassed. They don't come forward. So we need to encourage them, break that silence. If something has happened to you or is happening to you, for example, remember different forms of abuse you may get, then you need to come forward. Even if you are a man, at the end of the day, you are a human being.
Yes. Thank you, Dr. Soni, for sharing such vital insights on gender-based violence, chronic take care and travel health. Are there any final parting words to our listeners as we gear towards the festive break, and how can the listeners get in touch with you?
Wherever you headed, travel safely. Be mindful, alert, and cautious. Arrive healthy so you can enjoy every moment. Stay hydrated. Travel wisely and take care of yourselves so we can all make it to the new year safe and well. Happy holidays to all. I will give you 2 sets of telephone numbers: 033 3425 024. That is my practice in Pietermaritzburg. Alternatively, if it's GBV related and you need to contact the crisis center at Northdale Hospital, 033 3976 420. Thank you.
Jazakallah so much, Dr. Soni, and we definitely will plug you for another show, probably next year, inshallah, with all the wealth of knowledge that you have to impart to our listeners. Listeners, remember, your health is your greatest asset. Don't hesitate to reach out to your local clinic, crisis center, or travel medicine specialists. To our technicians, Durban, Pietermaritzburg, and the whole Ansar team, and to you guys, listeners, this is your Pulse Show, and Jazakallah for listening. And we'd like to sign off for now. Stay safe, stay healthy. Until next time, keep listening, keep caring. Assalamu alaikum wa rahmatullahi wa barakatuhu.
Will help you with any medical problems you have by giving you advice on air. However, they do not have your full medical history and they have not seen you. Please verify the advice given to you on air with your doctor who knows you better. Neither the doctors nor Radio Al Ansar will be held responsible for any ill health caused by the advice given on Radio Al Ansar.
Radio Al Ansar, 24/7, 365.
An informative Islamic global perspective. This is Al Ansar News.